Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.
Maayong gabi yung mga followers sa Facebook pages of the Department of Health Central Visayas of the Philippine Information Agency sa Region 7 sa ato ang mga viewers karong gabi una. And welcome to another episode sa ato ang DOH weekly natong BIDA Solusyon Virtual Presser. Kili si Rachel Nesha, gikan sa Philippine Information Agency Region 7, and I will be moderating once again ang ato ang virtual presser karong gabi una.
As of August 11, 23 na lang gyud ang ato ang number of new cases. Mandaue has 10, Lapu-Lapu City has 11, and Cebu Province has 18. So mo kana siya ang atong mga latest, no? Ang total laboratory results na that were released for August 11 is 1,066, no? And out of this is 75 positive. The rest are negative, no? So diha nato makita nga ang atong admitted cases also is 1,237. Those that are in isolation is 3,179. Gusto sad nako ipahibalo sa atong mga viewers, no, Miss Rachel, no, nga atong utilization rate, no, our critical utilization rate as of yesterday is only 32.2%, for the total nga gigamit nato nga mga beds. Pero sa ato ang wards nato 31.1%, pero ang atong intensive care unit is only 39.8%. So you can just imagine, no, na grabe nakaubos gyud, meaning to say gamay na lang ang mga tao nga nasa sulod sa ospital, and we would say na daghan naaman pud na sila sa mga isolation facilities, but then that means it gives us enough space should patients will require the hospital beds.
Yes. Doc, I'd like good news gihapon, no? Thank you for sharing that, Doc. Nya murag, it's nice to see gyud ang mubo nga numbers, especially for Cebu City nga nanan sa 20s na lang gina report nato, Doc. No, pero I'd like to zoom in first, Doc, sa recovery rate. Increasing gyud siya, Doc. Can I ask, naabay something? Are we implementing something new, or what can we attribute this to ang ato ang increasing recovery rate?
Okay, there are several factors that could have affected the recoveries. No, number one, kana bitong awareness of the people, meaning to say, you know na you're not feeling very well, and you know, I'm not really, and I need to see a doctor or seek consultation. So that one really has a great impact. Kaya nga naman, if you seek early consultation, early diagnosis, early management, and treatment, then you recover faster and the recovery rate is higher compared to those nga ibaliwala nila ang ilang gibate. So that's one. So there is people awareness. Secondly, there is also that feeling bitaw na if you go to the hospitals nowadays, you are not really that afraid anymore. Unlike dati nga, mahadlok ko mo to hospital kay matakdan mo niya ako COVID. So karon medyo ni gamay-gamay na kanang ingon ni ana nga thinking. Thirdly, our doctors are more confident in treating and managing our cases also. That's why even for those that are moderately ill, no, they're giving them augmentations in terms of management of care, so that it will improve further the recovery rates of our people who are affected with COVID. So basically, I would say nga, even the PTMFs and the isolation facilities, no, these are manned already by people who really know what they're doing also. So it increases your level of confidence. At the same time, it makes you assured na musulod gani ko din ha, inigawas na ako, maulian gid ko. So these are factors, no, that we have to take into account why the recovery rate is very high. It's not because ang COVID dili makamatay. It's really because of the factors that I mentioned.
Yes, katong tuloy Dok no nya. At least no I think importante nga may bawaan sa katawhan Dok na kaning tulo ka factors nga imong gi-mention because in the absence of a kanang cure pa sa pagkakaroon Dok, importante gyud ang awareness gyud ay Dok no on the safety protocols and knowing what to do when you start experiencing the symptoms. Nya murag mao man gyud na ang focus karon sa BIDA Solusyon campaign sa DOH no. Unsay first step nga buhaton ug naatay symptoms nga gibati nga basic pareha no sa COVID-19. Unya Doc, a quick lang nga assessment from your end. I know nga dili nimo ganahan pangunahan ang IATO. Pero ako lang pangutana Doc because it's August 12. Unya 3 days away. Unsa man Doc, are you medyo positive ba atong pananaw ani Doc nga mapadayon sa pagkakaroon ang kining ato ang classification particularly for quarantine sa Cebu City no kay mao man like you said mao man gyud ni ang nagdugay gyud sa ECQ.
There are two things that will happen on August 15 midnight. It can either be we retain as a GCQ or we go MGCQ. So mo lang yun ang kumusulti Miss Rach no. There are only two things that will happen there but never as an MECQ or an ECQ again, no? Because if you notice again, the IATF has guidelines and criteria why they put a particular place into that category of quarantine status.
Yeah, Doc, I think also because this week, if I'm not mistaken, it's World Mask Week, no? Na ay gibuhata nga celebration or observation aron mapahingusgan gyud ang kampanya aning health and safety protocols nga buhaton no sa kada usa nato in wearing the mask properly nya. Una Doc, ako lang siguro before we go to the how to wear the mask properly because I think I see naagihapoy nagpadayon Doc mo nga hikapo nila ilang mask, they pull it down when they're talking to someone. First Doc, kaning face shield no? Okay. I think the local government units and the national government is already kanang campaigning no nga advocating for people, urging people to start wearing their face shield, especially if they're going to ride the transportation. Unya Doc, I'd like to ask lang from the medical point of view, makatabang ba mas effective ba gyud Doc nga naa natay mask than naa pa jud tay face shield?
Okay, very good question, Miss Rachel. No? If you look at the pathology of the transmission of the virus, no, kabalo man ta sa iyang route of entry or portals of entry, no. So kabalo ta atong mata, atong ilong, ang ato ang baba, no, because these are the ways by which the virus can enter our system. So that's the reason why na we have all of these health measures no that we are implementing. But let me give you lang if you percentage no. If you wear mask with a face shield, you're able to protect yourself around 93%. Okay?
Wow.
Now, if you're going to wear your mask and just mask and 1 meter physical distance, you're going to protect yourself 94%. Okay? Now, if you're going to wear your mask and then you have your 2 meters distance, that is going to increase it by 97%. Wow. And if you're going to have your mask plus 2 meters distance plus a face shield, you're going to increase your protection by 99%. So basically, I think that's the reason why they want to implement also the face shield. And primarily also, I believe it's because sometimes in the public transport, when you're lining up no, for a public transport or when you're in a very crowded place and physical distancing is not feasible, okay, nagsiksikan kayo, that's why they wanted that face shield as an additional measure no, if you are not able to comply with the 2 meters na physical distance.
Okay, that's good to know, Doc. No? Kay, ako, I'm even starting to wear na yun, Doc, the face shield. So that means, Doc, let's go to the mask. No? Kanang mask, idagang pangutana mo gud ana, Doc. Kinsa man jay angay mo gamit og surgical mask. Kay, naamang giuban, Doc, nga daghan ang mupalit sa pharmacies, mahutda ng kausahay ang butika, kay daghang namalit sa surgical mask. And there are also sellers na karon, Doc, of katong cloth masks lang. Doc, can you tell us, Doc, any kanang mura o guidance lang on so that people will know kung kinsa magiangay aning sa surgical mask or kaning sa cloth masks?
All right. So thank you, Kaya, Miss Rachel. No, these are very good questions, no. And I believe na dapat ang mga tao makasabot ni ani niya. Ang kaning mga surgical or medical grade masks that should be used by healthcare workers. Okay, mas kinahanglan man na nila, di ba? Now, for those who are, people who are just walking or they want to go out to buy something or even inside their homes, no? Or if you have no close contact with people who are COVID confirmed positive cases, you can actually wear your cloth masks. Pwede ra gyud na siya. Ang naalang na siya ay apan. Kinahanglan lang, kung gamit ka cloth mask, make sure, kaya daghan na magapangtahi ka rin mga cloth masks, no? Kakaibog na gani ko ng mga designer masks, no? Parang feeling niyo, wow, amazing, I wanna wear that, okay? Parang status symbol na ngayon ng mga masks, no? Diba? Parang fashion statement na siya, di ba? So, if it's a cloth mask, mas mayo ang cotton. And then kailangan siya yung hindi masyadong makapal, hindi din siya masyadong manipis. At when you look at it under, dito sa hayag nga suga, na dili dagko ang yang grano.
Okay.
Has to be very smooth as much as possible because that is where, kung dagko ang grano, the pores are big, no? Bigger enough, no? Mas dali manggod ang droplets makalusot ana niya or makasulod. Okay, so mo na siya. And secondly, if it's a cloth mask,
before you continue, Doc, kanang sa imong pag-test ba, Doc, sa cloth, nakakita mo kung kauban, Doc, nga ilang og water under the faucet, ilang anaan og tubig niya kung wala kunoy mo mo trickle, mao daw na siya.
Yes, that's correct. That's correct, Miss Rachel. So, kailangan siya, alam mo yung mga kumot, yung mga cotton blankets na ginagamit natin, di ba masarap sa balat natin yan? These are actually very good materials for making cloth masks. Okay? At kailangan yan, kagaya lang ng mga surgical masks, no? Kasi marami ding naglilipana na surgical masks, no? Sinabi nga natin, meron pang mga misbranded, mislabeled face mask, di ba? So, kailangan natin yan, kailangan double layer. Pinaka-minimum na requirement mo niyan, double layer, hindi po pwede yung single layer na. Better pa nga pagka mga surgical or mga medical grade mask, triple ang layer niya yan. So ang cloth mask can be created in such a manner also, na dapat double ang yang layers, no? Para naagid kay pangharang for any droplets that may enter, that may be in the environment, no? While you are walking around, while you're talking, while you meet with people, no? So yan yung pagkakaano nila now. For the cloth masks, you can actually reuse that by washing it. Okay? So kailangan labhan ng maayos, patuyuin ng maayos, no? So that you can use it again. So you can reuse it. All right? For surgical masks, these are disposable masks. Hindi siya po pwede na i-recycle mo paulit-ulit, no? Na lalabhan mo. The moment you do that, you destroy already yung protective layer ng surgical mask. So dapat hindi mo siya lalabhan. Okay, so even with the different kinds of masks, no, that the healthcare worker can use, lahi-lahi po na sila. Natin ginatawag nga ka ng mga N95, no? Or KN94, or those with respirators. Kana sila ideally to be used yun na siya by people working in the hospital who are directly involved in the care of COVID patients. And ginagamit po na siya sa atong mga laboratories because the people in the laboratories, the medical technologists, the laboratory technicians, and the doctors who are assigned there will actually be handling also pathogenic materials. So, muna sila ang ideal nga gamiton para ipagamit na sa ilaha. Pero kanang mga uban nga mga nurses nato or mga doctors who may not be assigned to the COVID places, pwede na yun ka na atong ginatawag og surgical masks, kana atong kakakita nga mga blue or green, no? And make sure lang yun nga double layer na siya or pinakataasan na niya triple layer. Now, isa sa ako ang gusto nga ipahimagno sa atong mga viewers bitaw, Miss Rach, kani bitaw makita natong uban nga mga kauban nato nga galakaw-lakaw nga gagamit og masks with bulbs.
Yes.
Kita niyo na yung mga bulbs nga more na yung mga gagmay nga mga kuan niya. Okay. We
Para
discourage,
makakawalan sila? Oo.
yes, the valves, no? We discourage people using that, particularly when they go out. And there are even hospitals that will disallow you to enter their premises kung mao ka na ang klase nga mask na imong gamiton. Ang rationale ni Ana, it's because while you are breathing, air in, and then you also expel air, no? Nga mugawas adto niya, kung ikaw, you have COVID without you knowing it, or you are positive for COVID, you can actually expel the droplets.
Through the
So,
back. Pinaagi
yeah,
sa
through the bag. Oo. Kaya mura man na siya, kanang airway, manggihapon na siya. That's why we do not encourage people to be using that one. Okay, so, isa na siya sa misconception nga uban, ganahan kayo maggamit ana niya, no? We do not encourage people to be using that one. Okay, so that is for the masks. Now, there are also tips for the use of masks. No? We will demonstrate that later on how to properly use the mask. Okay, so siguro, we'll start it now before akong tips no, on how to take care of those reusable masks. Okay?
Yes.
So, isa sa ato ang kinahanglan masabtan ang paggamit sa mask. So before you put on your mask, you need to sanitize your hand. Or kung naay sabon o tubig, panghugasa. Alright? So you have to sanitize your hand. Okay? And then after you have had that, then you pick up your mask. Make sure, no? Kani akong gamit kay surgical mask mani. Naman ni ka ng murag ihang gahi nga portion. Ha? Medyo na-steal niya. So, you make sure na you use it like that. So, you cover your nose and your mouth. I-loop nimo ang imong string sa imong ears nimo. Okay? And then, make sure you adjust and then pull it down. So, that is how you use your face mask. Dili siya pwede nga ang sulod ani niya imo hangkuptan bago nimo siya gamiton. Okay, so that's
Doc, that applies also to cloth mask. Ang kanang sulod.
that's the same for the cloth mask. So you handle yung sa tunga niya and then dahil kuptan nimo, isulod nimo ang imong ear loops nimo or strings nimo. The same for here and then i-pinch nimo siya gamay sa nose bridge para ma-seal off nimo siya. Pull it down to cover your chin. That's correct, Miss Rachel. So that's how it has to be covered here, covered there. All right? So muna siya ang proper way of using the mask, whether it's a medical grade, a surgical grade, or a cloth mask. Now, when you remove this one, at the end of the day, gusto nimo nga tanggalon siya, you always, touch this one. Okay, you remove it. Again, this one, do not touch the inner side, ha? Ayaw yun na siya tanduga. Then, if it is for disposal already, place it in a sealed plastic. So, pasok mo siya doon para ma-seal mo siya bago mo siya i-dispose. Now, for those na mga reusable masks, it's the same process. Imo sang ibutang sa imong ziplock and then pag-abot sa balay, ibabad sa tubig with soap. Okay, warm water with laundry soap kung gusto mo or bath soap para mahugasan siya. Alright? Now, it's very important that these masks should not be thrown anywhere. Kasi you are again spreading the virus. So, kailangan siya nakalagay sa isang naka-seal off na plastic bago mo siya i-dispose and dispose of it properly. So, after you have removed this one, then you are again to sanitize your hand, or if you have water and soap, you again, clean your hands. That's how you are going to make sure na sigurado ka nga pagbutang nimo o pagtanggal nimo, wala nimo gi-spread ang virus.
Okay. Doc, that's very educational. Bisan ako, Doc. Murag, kanari bitang the act of putting it on raba sa una ba, we were not conscious about that. But now that we know nga na-adjoy, kinahanglang naakay i-follow, na procedure niya. Ako pangutana, Doc, because I don't think na ang mga tao are conscious about how they dispose of the katong disposable mask, ang surgical mask. So, dapat Doc, nga dili siya isagol tanan because I know na uban nga tapukon bitaw nila tanan, usaho nila og labay?
No, 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 no. When you're going to dispose of this, remember, you're not going to touch the inner of this. Ikaw mismo, nga gikan na gamit ani niya, you make sure that you are going to put it like that. And then, sarado mo siya, lagay mo sa isang plastic, bago mo siya itapon. Alright? So, it's not na nakatiwangwang na, ana lang siya, murag mo pag itandog, labay lang ni mo bisan as. It should not be like that.
Nood na, Doc, no? Because whenever na at makagawas ko, I see some masks that sa streets, no? Naalang gilabay lang nga niya. Mo ka na, no? Bisag nag-careful ang usa ka tawo, but you are still kanang possibly spreading the virus by not disposing your mask properly.
That's now, there's another one, Miss Rachel. KN94 or N95 masks.
Yes, that one.
Mga ganito naman, mga ibang klaseng mga masks naman. This one, especially the N95, we can actually reuse them, no? Pero this has to be dried, air dried. Meron tayong sampayan yan sa bahay or sa ospital, i-air dry siya for 3 days. Pwede siya doon i-air dry. Meron siyang parang sampayan para air dry siya or kaya i-autoclave mo siya and then pwede mo na siyang gamitin ulit. So you can reuse that for a certain period of time. Okay? Now, another thing na kailangan tandaan natin is in the use of face masks, no? Kailangan kung pawis na pawis ka, hindi ka naglakaw o nag-walking ka, nag-jogging ka or na-late ka na sa trabaho, dagan yun ka. So pawis na pawis ka with your face mask on, it is actually better for you to change your face mask. Kasi kung sobrang basa na siya ng pawis, then you have also removed already the effectivity of that face mask to protect you from getting the virus.
Okay. Pero Doc, if wala lang, if you're in an office, no, like since most are now going back to their offices and they are wearing this, so inside air condition, it's okay lang, Doc, one mask lang for the entire day ang gamiton?
Yes, it can be. Wala namang problem. Even kami nga sa workplace namin, a single mask that you can use for the entire duty day or 8 hours nimo, provided lagi nga wala ka sobrang kay pawis na basang-basa na yung face mask mo, no? O kaya naman alam mo naman na masyado ng maraming tao masyado doon sa palibot mo, then it would be easy for you also to bring in an extra pair of mask.
Oo. Kana, Doc, no? Bring an extra pair. Mo po na tip na dapat mahibawan natong tanan. An extra pair of mask with you. Unya, I think also, dako kayo itong kanang punto po nga kanang only the health workers, Doc, ang dapat magamit atong mga surgical masks that we consider because I know a lot of people nga bisag dili sila medical frontliners pero sige nagpalit no aning surgical mask because they thought nga only the surgical mask ang effective. So, Doc, how can you tell kung double layer siya, Doc?
For this one, you will be able to see kung anawin mo siya, you will be able to see that there's a double layer. There's one there, there's another one here. So muna makita nimo double layer siya. Nayuban ngayon ni ani nga triple ang layers nila. So there's another one in between pag yun. Okay, so that's how you are going to your mask. Now, for those washable masks that you have, you can actually pwede ibabad sandali sa maligamgam na tubig with sabon, no? Para malabhan siya. And then, dayan, wasusan mo ng maayos, i-air dry mo siya. Then, it's going to be useful again the following day.
Okay, oo. But that's daghan kay mig na pick up ni mo karon, Doc, na information about the masks, and it's really good because until we have a cure or a vaccine, we need to keep wearing. So muna nga atong i-follow no ato ang I know that the Department of Health adunay Facebook page for BIDA Solusyon. So please no katong nagtanaw nato karon after listening to Dr. Lorette share the tips na to on how to wear the mask, you can find out more on how you can maintain no ang inyong masks, how you should use it dito sa Facebook page of the BIDA Solusyon sa Department of Health, no? Just search for the BIDA Solusyon, naa dito no unsay mga angay ninyong kinahanglang buhat,
Yes.
no?
Okay, so yes.
Yeah, Doc, naalam ko last question, Doc, no, for you before I ask for your closing statement, Doc, because I know nga naapay laing engagements si Dr. Loreche. Doc, siguro, Doc, mangayo na lang ko og kanang imuhang mga advisories, no, especially nga World Mask Week, but it should not end only for this week ang mask, ang wearing of mask, wearing of face shields, and also katong mga reminders pud siguro, Doc, for those who are buying kay basi unyag since the surgical mask na anay daghang manufacture pero wala ta kabalog, Doc, if they are really approved, no, or medically kanang the proper gyud nga masks ba. So ato lang siguro mga
So, thank you, Miss Rachel. No? So, atong hinumduman, ang mask wearing is already the new normal. So, it is something na dili na yun na nato pakawalan because that is going to be with us until such time that this pandemic is already out. No? And even with the vaccines coming around, I think mask wearing is still a must. No? So, mask is a must. And ang ikinaganda naman nito ay, syempre, sa mga kababaihan, hindi mo na kailangan ng lipstick kasi hindi naman makikita yung lipstick mo di ba? Hindi mo na kailangan ng makeup kasi natatakpan naman na siya. So, lahat tayo maganda na. Okay? So, yun na. Kilay is life na lang. Alright? So, so we have to continue on using our masks and use it properly. But more importantly, we have to know how to dispose of it properly as well. So mahirap naman yun na gumagamit tayo and yet kinakalat natin. And in retrospect, we are also causing the transmission further of the virus. So BIDA Solusyon, again, we have to be able to follow that one. The minimum health standards will always be part of us. And we believe that if we can actually discipline ourselves by following the BIDA Solusyon, then we are in a better position in our fight against COVID.
Thank you, Dr. Mary G. Loreche, ang ato ang spokesperson for COVID-19 dinhi sa DOH Central Visayas. Doc, thank you for sharing with us. No, very educational, very informative nga mga kinanglan mahibawaan nato no regarding ani ang pag-wear sa mask and also katong mga regarding the valve na we should be careful in using that. And disposing the mask properly kay mao kana no, it's not only on the wearing but also sa disposal nato. Muna nga according to Dr. Loreche, the mask is still a must. Quotable quote na ni Doc for today. So kinahanglan ato ng hinumduman no. So thank you, Doc, and we will see you again, Doc, next week for another round of updates. And when we have another, Doc, na-announce na ang next level of quarantine classification also for Region 7. Daghang salamat, yes. Doc.
Okay, bye.
Bye, Doc. Oo, nya. Karon, with all the ato ang mga learnings right now regarding sa face mask, we will move on na po no, sa another observation na critical gihapon kini sa pagkakaroon nagpadayon kini nga advocacy sa Department of Health o sa Philippine government ang kining breastfeeding kay naamang gyud mga anak no naamang gyud gihapon our families continue to expand and in the middle of the pandemic daghang pangutana regarding breastfeeding. But before that, atong pangutanon atong resource person no si Ma'am Ronadit Capala Aresgado regarding ani nganong naamang gyud tanoy naatay observation. Why is there an observation for breastfeeding DOH? So siguro a little backgrounder, Ma'am Rona, regarding sa atuang observation. Go ahead, Ma'am Rona Dick.
Okay, Miss Rachel. So we are celebrating the Breastfeeding Awareness Month, but not di lang kita, no? It is a worldwide celebration funded by WHO. Here in the Philippines, gihimo gyud na siya in order to protect, to promote, ug support sa tanang the breastfeed and for the practices of breastfeeding kay mao gyud ni siya ang atong natural and preferred method of feeding sa atong infants ug young children. And also ginabuhat ni siya ang atong Breastfeeding Awareness Month to to give awareness no sa tanang mga sa atong community on what is the importance of breastfeeding. In fact, naaga ni tay back 2006 na Presidential Proclamation number 1093 nga nag-declare nga ang August 1 to 7 will be the National Breastfeeding Week of the Philippines. And also another one, according to our RA 10028, ang August, whole month of August ang declare of National Breastfeeding Awareness Month.
Okay, Ma'am Rona, I'd like to ask lang, no, since naamay pandemic naapa ang COVID-19, kunya August mo katuno an awareness tibuok month nato ang awareness nato for breastfeeding ang ato ang kampanya gi unsa man nato ron Ma'am Rona pag-observe naabatay activities nga gi-implement ang DOH nga especially since wala may kanang di pa man allowed no ang mass gatherings yan nakainumdum ko Ma'am Rona. I think I remember in the previous years na aman tuy murag dako-dako no nga pagtapok sa mga mothers who would breastfeed their babies at the same time. So for this year, for this month, Ma'am, how are we going to observe no ang atong activities for breastfeeding?
Yes, ma'am. It has been really a difficulty, no? Given nga dili ta pwede mag-mass gathering. Where in the previous years, we conducted together with our private partners a big latch-on wherein our mothers breastfeed for at least a minute niya. Ato silang ithon kung how many were able to latch on in 1 minute. This year, actually, we did it virtually, no? It was launched on August 2, last Sunday, during the virtual Big Latch on 2020. It is karon na gyud ta nag-virtual, no? Yearly organized ni siya with our private partners, Glory Reborn, Tita Doc Ma'am, and also it was still done in Bohol, no? With ang lead agency dito is our DOH Hospital, Governor Celestino Gallares. So what we did is ang tanan ni register nga moms went virtually na. So mura nagkanang Zoom ni tanan, no? And then same gihapon siya og process when amo lang siya igikuan kanang gi-set ang timer to 1 minute, screenshots on all the breastfeeding moms nga nag-breastfeed on that minute. So, gingana na mo kasihap. So, for this year, more or less, including Cebu and Bohol, naabot kita og almost 500, no, nga nagkanang latch.
Latch, okay. Virtually.
Still, dagan siya difficulty, kaya katong unable to join virtually, katong walay mga internet or walay cellphones, dili gid sila ma-appeal og count.
Ma'am Rona, kanino tungod naapamanggigip ang pandemic. So, how is COVID-19 affecting the breastfeeding, Ma'am Rona? Like, I don't know if since sa una no murag free raman to go to clinics kung naa sila yung mga ma-experience, pero mas challenging ba karon ang pag-breastfeed in the middle nga of the COVID-19 pandemic?
Yes, actually, COVID-19 is really affecting breastfeeding in two ways. That siya affect it positively because the mother and child can have longer time with each other, especially katong mga working moms, stay at home na lang gyud siya, no? And but negatively, na gyud ko'y sense of fear ato ang mothers to nga, especially those nga are unable to stay inside, katong mga work or go out to get errands, magkuan, magdato sa market, mahadlok ni gyud sila nga inig uli nila sila ang carrier, no, ma-transfer nila nga to sa ilang baby. So mao na siya. That is why nga ang uban mo choose na lang to formula milk their babies than to continue breastfeeding tungod sa sense of fear.
Okay. Oo, so ako pangutana Ma'am Rona, with mauna no ang na-fear, is there naabatay can COVID-19 kung for example positive no carrier ang mother, ma-transmit ba kini through breastfeeding paingon sa baby?
Actually, there are no kung ano, research na sa ato ang mga higher ups sa WHO and sa DOH if breastfeeding can be transferred through breast milk. But actually, as of now, wala joy evidence that COVID-19 can be transferred through breast milk. So even those nga mga moms na COVID-19 and there are also just number lang jud no gamay ra jud kay nga na positive food ila babies, it was not through breast milk. In other instances na siya dili gyud sa breast milk.
Okay. So, meaning to say, no, kanang safe gihapon ang pag-breastfeed even if, for example, ang mother has naa na siya symptoms or inuntan na test na siya positive for COVID-19. Pero unsa may naabay guidelines ana Ma'am Rona kung for example COVID-19 si mother na ba siya dapat aduna ba siya dapat buhaton nga in preparation for breastfeeding nga unique no nga kanang sa una wala nila ginabuhat when they were breastfeeding regularly but now that they're COVID-19 positive na ba sila angay hinumduman when they breastfeed their babies?
Yes, of course, no. When you're COVID-19 positive or even just a suspect, we would really recommend that you continue breastfeeding because kanang daghan yun ni siya benefit. It outweighs the fear of getting the COVID-19. So what they should do, no, before they breastfeed, especially if you are COVID positive or just a suspect, you should wash your hands frequently, especially before ka mo touch sa atong baby. Pwede wash our hands o dili ka wash mo hands, pwede ra atong alcohol-based rub no sa atong hands. And then of course, you should wear medical mask no. Gitawag ang surgical mask gid atong gamiton when we breastfeed, dili ang katong cloth mask no. But it is important to kanang replace the mask kung basa na siya. Katong giingon ni Doc Loreche a while ago, buhaton yun gyapon to, dapat i-dispose siya properly. And then, if mo sneeze or mo cough ang mom, especially if you are positive, apil naman na sa iyang symptoms, make sure nga si mom while nag-breastfeed na siya tissue or cloth nga to siya mo sneeze into, dili mo ato sa baby. And then, i-dispose. And lastly, we should kanang sanitize our surfaces. Kaya di majud malikayan nga maggunit sa while nag-breastfeed, especially if taas siya 30 minutes to 1 hour na breastfeed, ato lang jud i-sanitize atong surfaces. So basically mo ora gyud na siya. But even in instances, ma'am, recommended yapon sa gatong mga moms na wala jud di jud able kapalit og medical mask or even face mask. Bahalag wala sila face mask, mag-breastfeed gyud yapon sila. You recommend yapon na siya. Because there is a minimal chance of the baby to get the COVID-19. In fact, our infants are at low risk of this COVID-19 virus.
Oh, no? Ingon anak ang mother's milk, no? So, Ma'am Rona, meaning to say, can you give us an idea lang siguro kung saan ang benefits gyud nga makuha sa bata na para ma-convince no ang mothers because I know nga aside sa I think one of the reasons why dili mo breastfeed ang ubang mothers is because busy daw sila, no? Busy sa work, niya they only are home na magabi na or buntag wala tardy, wala sa silang balay. So, katimong giingon ma'am no, nga they put it in a kanang bottle, niya i-keep lang nila sa refrigerator. So, technically dili naman na siya breastfeeding, no? Kay murag gibutang naman nila sa container. So, pero sa man ang benefits, ma'am, para ma-convince gyud ang mothers nga makapangita gyud paagi no nga breastfeed gyud sila sa ilang mga anak.
Okay, so one of the benefits to nga gusto na ako mahinumduman sa atong mothers on breast milk or breastfeeding is it reduces the risk of death among newborns and infants. So katong sa nagtikataas sa ato ang breastfeeding rate, nagtikaubos pud ato ang mortality rate sa ato ang infants and newborns. And also naapa siya lifelong nga advantages no dili lang sa karon nga time, also sa lifelong nga makakuha ng iyang brain development and ang iyang IQ. Ang IQ sa nato kay mo benefit no mo mas taas siya IQ compared to those who are not breastfeed. Also again, it outweighs the threat of COVID. And also, bisag sa, in fact, in the Philippines, di ba, we still have poverty. So, there are those na makita na to nga mag-formula feed. But breastfeeding helps in solving the poverty, no? Kanang wala na gud tay out of pocket when we breastfeed, wala na tay bottles to use. So maka-help siya nato economically, and also it helps the mother. Kanang it helps the mother mas low risk siya to ovarian and breast cancer, and also it helps in family planning nga ma-space jud nato ato ang babies.
So, ang benefits not only for the baby but also for the mother, no? Both of them kanang naay makuha out of breastfeeding niya. Ma'am, naapoy uban ma'am nga maulaw mag-breastfeeding in public, no? I think some people are embarrassed, some women, some mothers no ma-embarrass sila mag-breastfeed in public. Not only sila mismo na-embarrass but the reaction also of some people around them ba nga tan-awon sila. So unsa may ato ang reaction anak ma'am?
Actually, ang kanang breastfeeding in public is not against the law. That's what I want to share to the mothers, no? Kay even ako, I have a 2-year-old, I still breastfeed and I am not embarrassed, no? Breastfeeding in public. There are just those nga kanang bias na kanang lahi jud ilang pananaw sa nag-breastfeed, ang mga mulabay, pero it's kanang depende sa mother, no? Kung if she is really shy, we have lactation stations provided, no? Na gibutang na sa ato ang RA 10028 that our offices should have lactation stations so that the mother can confidently breastfeed. And also there are those nga ato ang malls, they already have lactation station. So pwede ra ta mo breastfeed dito. And there are also mga bag-o na ron nga mga breastfeeding covers. No, na pwede na mapalit nato breastfeeding covers. And I even used one nga kanang unsay tawag ani kanang blouse gani nga pwede na siya i-open lang ang gamay ra ang makita nga breastfeed. So they can use other alternatives as long as if there's a will, there's a way, good ma'am.
Atong lactation stations nato ma'am Ron, kaning mga business established like malls no na mention nimo, naabay monitoring atong gibuhat ani ma'am Rona nga naa ba nag-comply ba atong mga malls ani dinhi sa I guess dinhi sa Central Visayas or dinhi sa Cebu?
Actually, there are a lot of malls na nga nag-comply ani, especially our big malls. But those kaning atong monitoring ani and to apply for the breastfeeding in establishment are under our local government unit. But DOH, under siya sa local government unit, but DOH will also assist in the certifying of this lactation station.
Atong gihangyo ma'am Ron, no, ang are we encouraging the local government units to make sure nga nag-comply siguro ang ato ang mga malls aning ato ang
yes ma'am.
Stations?
Yes ma'am, we lobby, we encourage, and we do also coordinative meetings to make this make this activity or make this lactation station sa tanan natong establishment.
Oo. Kay importante no sama sa giingon nimo Ma'am Rona na even kung naatay health crisis nga giatubang, magpadayon gid ang breastfeeding, no? More important na gid siya, actually more critical now that we have a health crisis kay dako man ang protection nga mahatag sa bata, both sa bata and the benefits that the mother also gets. So thank you kayo Ma'am Rona, no? Ubay-ubay gid ang ato ang nakuha karon nga information regarding aning breastfeeding sa katong mga for those mothers nato nga breastfeed or katong mga women who are about to give birth, no? Or mga mothers would be, maayo ko to nga mga reminders ang gihatag ni Ma'am Rona, no, regarding breastfeeding. So Ma'am, to wrap up ang atong discussion, mangayo lang ko sa imuhang closing statements, no? Kung unsa may ato ang hangyo karon Ma'am for the mothers and also for the local government units kay naaman po sila role aning ato ang kampanya nga ma-promote ang atong breastfeeding.
Okay, so I would just like to give these 4 messages no nga ato jong hinumduman for our mothers, for our local government units when we are promoting that breastfeeding no and skin-to-skin contact significantly reduces the death of newborns and infants. So dili lang breastfeeding ha. So katong mga bago pang panganak, skin-to-skin gid sila diretso sa ilang mothers no. That's what we practice in our hospitals. And also another message is that always remember na atong newborns and infants are at low risk of say tawag na the COVID-19 infection. So low risk ra gyud siya. So sa atong number of population na na-affected sa COVID-19, gamay ra jud kayo ang ato ang infants, and the number nga gamay ra dili gyud na siya through breast milk. And always thirdly is that the numerous benefits of breastfeeding will always outweigh no the fear of the COVID-19 infection. And lastly no, ang active COVID-19 virus has still no evidence na mo pass through siya sa breast milk. So continue breastfeeding without the fear of transmitting COVID-19.
Thank you, kaayo. Daghang salamat sa atong Nurse 5 from the Department of Health Central Visayas, si Ma'am Ronadit Capala Aresgado, sa imuhang mga updates and as well as reminders no regarding breastfeeding. Unya, ubay-ubay gyud ang ato ang napupo karon nga information or regarding ato ang health advisories not only for COVID but for the continued nutrition sa ato ang mga babies, sa mga infants, kay sila sad no vulnerable sad sila sa atong COVID-19 infection, but mao kato ang breastfeeding is one of the ways no nga maprotektahan nato ato ang mga babies against COVID-19. So breastfeeding is a must continue, and ato ang wearing of face masks must gihapon siya. Padayon gihapon kini karong panahon na kay wala pa man tay tambal og bakuna batok sa COVID-19. So thank you kaayo Ma'am Rona. Thank you sad no sa ato ang health nato nga technical ang info unit team nato sa DOH Central Visayas. Thank you so much for making possible once again ang ato ang weekly no a virtual presser for BIDA Solusyon. Unya sa ato ang mga viewers karon, kung wala pa kamo naka-like sa Facebook page of the BIDA Solusyon, please go and visit it and follow the page aron nga makakuha gihapon mo no, padayon mo makakuha og information on how to keep yourself and your loved ones protected and safe no, since we are still in the middle of the COVID-19 pandemic. So kini si Rachel na siya gikan sa PIA Region 7. Maayong gabi and see you again next week for another round sa atong BIDA Solusyon virtual presser dinhi lamang sa Department of Health Region 7 na Facebook page o sa Philippine Information Agency. Daghang salamat ug amping natong tanan.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.